Hello, I am Dr. Dutta and I'm an endocrinologist based in New Delhi. And I have with me Dr. Vineet Surana, who is also a very good endocrinologist based in New Delhi. And together we are here to discuss on medical nutrition therapy and its importance in diabetes management. So, Dr. Vineet, what is your take on diet and diabetes as a whole?
So, Dr. Deep, if we talk about the diet is something which we all know that each and every doctor keep emphasizing that when they start any patient on the diabetes therapy. But we need to go back and see that this is not new. Even the 3000 years back when there are the literature available, when they talk about the diabetes, the only treatment available was the whole grain. So people used to treat the diabetes with whole grain and cut down on other things. So and now even 3000 years down the line, again we are talking about the medical nutrition therapy. That's a refined version of the whole grain gut diet. Now if you see why, when we have so much of things available with us, including the insulin, why we are even talking about the medical nutrition therapy? I mean, I don't think it should happen actually, because we have a lot of newer drugs which have a lot of benefit also, but still we always tell our patient you do diet. Reason is, all across the world, including our country, India, we have seen that everything has failed if we don't do a good diet.
I think that's a very important point. I think nothing works without diet and lifestyle therapy, which Dr. Vineet is beautifully highlighting. Especially now we have data to show that in an obese, overweight person with diabetes, if they lose body weight, we can actually reverse diabetes. Yes. This Lancet paper which came last year in December 2017, which showed if a person loses 15 kilos weight or more, there is a 80% chance of reversing diabetes. If a person loses weight between 10 to 15 kilos, around 53% chance of reversing diabetes. If a person loses weight between 5 to 10 kilos, there is a 30% chance of reversing diabetes. So greater weight loss, more the reversal of diabetes. Reversal meaning stoppage of all diabetes medications. So, Dr. Vineet, can we do something with diet which can help us in reversing diabetes or weight loss?
So, Dr. Deep, if you see even the Atlantis paper which you are talking about, that is something which that is something which we have seen. In that also, they initially started with a very low caloric diet and finally they shifted into the moderate diet. And with that also patient had a reversal. So if we talk about a particular diet, nowadays we mostly tell our patient to be on a low carb diet.
Excellent. For Indians who are watching this program, from a day-to-day diet plans, can you suggest a simple low carbohydrate or a low calorie diet which we can make from day-to-day food objects?
So if you see the most important culprit which we talk about diabetes is your sugar. And the second in refined carb, refined flour in the form of the typically used maida, which you will see maida is something which is being used in everything, whether it is your cookies, your bread, your bakery, your pizza, your burger, your noodles. So all the tasty things which you talk about, or all the junk food or the fast food, are having predominantly maida.
So a very important point Dr. Vineet has said, that when we talk of low calorie diet, remove refined carbohydrates from your diet, eat less, eat tasty food. Nobody is asking you to stop eating spicy food. Remove refined sugars, use whole fruits, whole grains, go for protein based diet. If you are a vegetarian, you go for paneers and all those things. If you are a non-vegetarian, you can go for healthy non-veg food like fish or chicken. In the end, walk more, eat less, lose body weight and reverse your diabetes. Thank you.
That's the most important thing, Deep. And also, if we talk about something, so we always talk when we talk about the diabetes, what about the cholesterol? Cholesterol is something which everybody related with the diabetes. So what is your take about the cholesterol part?
So now we are coming to the second part, is cholesterol. We discussed of diabetes management. Cholesterol problem is so huge. So what I would like to highlight now is the cholesterol problem in Indians is different from that in the West. So when we do a lipid profile, we have different cholesterols. We have the LDL cholesterol, which is the bad cholesterol, which is raised in the Western world. In India, what is predominantly raised is the triglycerides or the more fatty type of a cholesterol, and there is something called the good cholesterol or HDL, the high density lipoprotein. It is much reduced in Indians. So this pattern of a raised triglyceride and low HDL predisposes to heart attacks, and let me tell you, we Indians die because of heart attacks. That's the most common cause of death in Indians, and heart attacks occur nearly 2 decades earlier in Indians.
Yes, that's actually true. And if you take this triglyceride and HDL story, again, if you see that this typically, again, what I was talking about the MNT, it's typically again come back to the same part, that you have to reduce your sugar content, you have to cut down on your refined flour, and you see that there is a dramatic improvement in your cholesterol profile also. So there is some dietary improvement which can be done through that. It's more than oil, your sugar and the refined flour which is important.
It's the sugar which is the culprit. Very important point highlighted by Dr. Vineet. And another practical issue, when we do a lipid profile, should we do in the fasting state or should we do after meals? Some school of thought in the West, they say you do a cholesterol testing after meals because most of the day we are in the post meal state. So why create an artificial fasting for 12 hours when we are after meals always, all the time? So in this regard, again, I would like to highlight, we have Indian data to show that triglyceride is the main problem. So if you have a high carbohydrate diet or a high fat diet, the triglyceride is raised. So the point is, if a person is having established diabetes, if a person has a high risk of heart attacks, if a person has history of pain abdomen or pancreatitis, in this scenario we should be doing lipid profile in the fasting state. But in an apparently healthy individual who has no problems, we just want to do a screening lipid profile that can be done at any point of the day.
Okay, that's actually an interesting point to be raised. But then, so we do see a lot of this thyroid patients also. So and they usually nowadays when the packages are going on, they do everything, and in that they do thyroid also, cholesterol also, sugar also, and you sometimes see that there is a derangement in the cholesterol with the thyroid patients. So how do you tackle them?
Again, a very important point. Hypothyroidism is very common, 6 to 8% prevalence in India. So if a person has severe uncontrolled hypothyroidism, means TSH is more than 10, and if there is raised cholesterol, please get your thyroid levels corrected, meet an endocrinologist, take the correct dose of thyroid hormone supplementation. In majority of you, the cholesterol levels will come down.
So that means we should not treat them actually.
Before, unless we correct the hypothyroidism, we shouldn't treat. Even after correcting hypothyroidism, if the cholesterol is high, only then we should start cholesterol medication.
That's an important message, that each and every thyroid patient should not be started on anti-cholesterol medication until unless their TSH is under control, right?
Yes. So to summarize today's presentation, we would like to highlight medical nutrition therapy has a very important role. Key message: eat less carbohydrates, go for whole grain and natural and whole fruits, avoid processed foods, and get your cholesterol checked. If you are having diabetes or heart problems, better to get your cholesterol checked in the fasting state. If you are having no problems, then you, as a screening purpose, you can do your cholesterol at any point of time. Lose body weight to reverse diabetes, lose body weight to prevent diabetes. Thank you, Dr. Vineet.
Thank you, Deep.